Have you heard of fatty liver disease? If not, it's a serious health condition that rarely shows symptoms. This is Dr. Naim Alkhouri of Arizona Liver Health. Great to have you with us. He's here to talk about some free trials, but first I want to ask you about two forms of this disease, NAFLD and NASH. What are they and how are they different?
So non-alcoholic fatty liver disease is a complication of obesity and type 2 diabetes where you have fat accumulating inside the liver. And that over time can lead to inflammation in the liver and then liver cell injury. And this is what we call NASH, non-alcoholic steatohepatitis, where you have fat but also inflammation and damage. And NASH is considered the severe form of fatty liver disease that can progress to liver cirrhosis and other complications. So again, fatty liver is the term we use to describe NAFLD and NASH, but NASH is the aggressive form that will need treatment and aggressive management.
So let's talk about some of the treatment options for patients who have either one of those conditions.
The first step and the mainstay of treatment is always lifestyle interventions to induce weight loss. And our goal for weight loss is about 10% of the actual body weight. So for someone who's 250 pounds, we aim for 25-pound weight loss. And that should help with both NASH and fatty liver. Unfortunately, it's easier said than done, and not all patients are successful with lifestyle interventions. And that's why we need pharmacologic treatments and medications.
Yes, and you guys are doing some clinical trials there. What should a patient consider before entering into a research trial?
Yeah, despite fatty liver disease being common, affecting 80 million Americans, we do not have any FDA-approved medications to treat this condition, especially NASH. So that's why we are working around the clock in these clinical trials. It is important to discuss with your provider, understand what phase you are in. Typically, more advanced trials like phase 2 and 3 will have more safety and efficacy data. And then also it's important to realize that there might be a placebo arm where you're not getting the active medication. So just a frank discussion with your provider to try to understand all the aspects of the trial. But the good thing about these trials is that you get free care. All the imaging and the medications and the visits are typically covered.
And something else that's free is a FibroScan that you offer there at your facility. What is that?
Yes, thanks for bringing this up. But this is a new machine that's based on ultrasound technology, and you get two numbers. The first one is how much fat you have inside the liver, so we know if you have fatty liver and how severe it is. But also we measure the stiffness of the liver, and that tells us if you're on your way toward liver cirrhosis and significant liver damage. So very easy test. You just have to fast for 3 hours before we do it, and it's non-invasive, simple, a very good way to determine your liver health. And I highly recommend it for anyone who's concerned about their liver.
And what I'm hearing here is this is reversible, and that's the goal.
Yes, fatty liver disease in early stages is completely reversible. Once you get to cirrhosis, then it becomes very hard to reverse. So that's why early identification and intervention is key.
Right, and coming there to Arizona Liver Health is where we should begin. A team of doctors working towards the best plan for us.
Yes, absolutely. And thank you so much for the introduction to Arizona Liver Health and our clinical trial program.
All right, thank you so much. We appreciate you. Let's give you a special offer for a free fatty liver screening. Call 480-470-4000. Arizona Liver Health, they have 2 locations, one in Chandler, one in Glendale. For more information, visit azliver.com/fibroscan.